Subscribe and press the bell icon so you never miss an update from PrepLadder.
Hi guys, let's take this one MCQ now. A 45-year-old woman who had two normal pregnancies 13 and 20 years ago presents with complaints of amenorrhea for 9 months. She's expressing the desire to become pregnant again at 45. After exclusion of pregnancy, which of the following is the next best test indicated in the evaluation of this patient's amenorrhea? Now, when do we say it's an amenorrhea? Any woman who is having regular cycles has now not got periods for 3 months, or any woman who's got regular or irregular cycles who's not got periods for 6 months. So 3 months with regular cycles and 6 months of any type of cycles, that is what is amenorrhea. Now, when a woman at 45 years is having amenorrhea, there is a lot more than just pregnancy running on your mind, because a woman at 45 is perimenopausal and she can actually be getting into menopause. So that's what you have to think of rather than a pregnancy at 45. Yes, it can happen, but that's a rare thing to happen. Okay, I'm sure that all of you are thinking of physiological causes of secondary amenorrhea as pregnancy all the time. We know that. But at 45, think of other causes like maybe she's getting into menopause. So the age of menopause, average age of menopause is 51 to 52 years in the world, and Indian average of menopause is 47 to 48 years. So if she gets a menopause at 45, it's not an alarm, isn't it? If she gets a menopause even at 43, 44, I'm not be so alarmed. Any woman who's not getting periods before 40 years, that's an alarm. Now, if a woman gets into menopause before 40 years, we call it premature ovarian failure. So yes, the ovaries will fail in menopause. All of us know that. The ovarian follicles get over, and once the follicles are over, that means there's no estrogen. When there's no estrogen, there's no periods. So a woman gets into menopause 47 to 48 years, but suppose a woman gets into menopause at 35 years. Now that is not called a menopause anymore. It's called a premature ovarian failure. So FSH, that's how we always remember it. FSH more than 40 before 40 years. FSH more than 40 before 40 years is known as a premature ovarian failure. So this woman is having period stopping around 45 years. So I would probably look at the values which I've just told you. Maybe they've gone a little high. All right. So doing an LH and FSH is my obvious conclusion to this question. Endometrial biopsy to see why she is not getting periods, it's too much of a test when I know that she's probably going to menopause at 45. So I will not do an endometrial biopsy. Karyotyping for what? She's getting amenorrhea, a second amenorrhea at 45 when she's already had 2 children who are 13 and 20 years of age, and nothing is wrong with them, nothing is wrong with this woman. So you don't have to do a karyotype at this moment, not at all. Hysterosalpingography. Well, if she's a menstruating woman and she wants to have a pregnancy and she's not conceiving, then I'll think in terms of doing a tubal evaluation. Not right now. She's not menstruated for 9 months. Maybe she's getting to menopause. So all of these choices eventually take me to choice number 1 as the best answer. I'll do the serum LH and FSH. Okay, so all of us know that the FSH, if it is more than 10 international units, it is suggestive of a menopause, and if it is more than 40 international units, we say it is a diagnosis. It's diagnostic of menopause. I'm writing MP here now. So this woman, an LH and FSH is the best obvious step to find out whether she's getting into menopause rather than trying to get into pregnancy now. Because yes, 45 years she can try a pregnancy, but natural pregnancy is not possible when her FSH is more than 10. Then we know she's getting into menopause, and if it is more than 40, then it is impossible. So what we say, that if a woman wants to have a pregnancy, the best time to have a pregnancy, is in fact 25 to 30 years. Yes, considering that the age of marriage now is 21 years. So we can say any time from 21 to 30 is a good time to have a pregnancy. But I say, all right, fine, girls should get into the education and should get settled and be independent. And by 25, they get married and have their first child. That's the best thing to do. And the ovarian reserve is also very good at 25 to 30 years. And 30 to 35 years is still decent. But after 36 years, there is more chances of aneuploidies, because it is the eggs which are getting old. It is the same cohort she is born with. You must know that. You know, a girl is born with a set number of oocytes, and after birth, this number is only reducing. So she's born with 1 or 2 million primordial follicles at birth, and she's left with around around puberty, she's left with around 3 to 4 lakh follicles. And every month she's going to ovulate one, but she's going to recruit around 1,000 primordial follicles every month to make that one dominant follicle in one oocyte. So she's going on reducing her number of eggs with the age. So finally, when she's around 35, 36 years, she's left with a few good follicles, and quite a few of them are not very healthy follicles, and they might give abnormal oocytes, and abnormal oocytes make abnormal babies. So that's why women who get pregnant after 35, what do we call them? We call them elderly gravidas, isn't it? Not because they're too old. 35 is no age to be called old. It's just that the egg number is less and the quality of eggs is poor, so the chances of having abnormal babies, that is aneuploidies, anomalies, that will increase more. So that's why we say after 35, that is 36 and more, there is increased chance of aneuploidies. That's why, you know, this is the age when people do a lot more of all those tests like triple marker and the quadruple marker and the amniocentesis, etc., etc. All of that will increase after 35 years. And after 40 years, if at all she tries for a pregnancy, there is a 40% chance of abortion. 40 after 40. 40% chance of abortion even if a woman gets pregnant after 40 years. So that's why when she's 45, trying for a pregnancy, I think it's just too far-fetched. She probably should be having a periods regularly at this moment, and if she's having that, she should be thankful. But this woman, I would first do an LH and FSH, and if that is all right, maybe I can think of giving her a pregnancy treatment. Having discussed all of that about this question, let me tell you one thing. A woman can get pregnant at 45 years, at 50 years also, but not with our own eggs. Nowadays, we do a lot of egg donation. Yes, we can get an egg. You know, suppose there's a woman who was very career-oriented and she was busy all her life, and now around 45, she wants to have a child and she's getting into menopause. Yes, we can help her by getting an egg of a younger woman, sperms of her husband, making an embryo and putting that embryo into her uterus. That uterus is still intact at 45, isn't it? Although if it is not menstruating, then we can give her an egg from outside, and with that egg and the sperms of the husband, the embryo can be implanted into the uterus and she can have a pregnancy with a oocyte donation. All right, that's the only way out. Otherwise, with her own eggs, she's getting into menopause, and only the LH and FS is all right. I will even try to think of giving her a pregnancy treatment. All right.